Hello everyone, welcome to another video. Imagine being a woman in your mid-40s and noticing that your period cycle varies in length each month. Over the course of the year, you wake up feeling tired all the time. Your memory is a little shaky, your mood swings easily, you feel achy, have headaches, and your sex drive is low. These symptoms may feel strange, but they are common for women going through a life change called menopause. Menopause is caused by the depletion of ovarian follicles. It is clinically diagnosed as a life stage after at least 1 year of no menstruation, typically around the age of 51 in the UK. Symptoms of menopause can last for a few months in some women, while for others they can continue for several years. More than half of women experience menopausal symptoms for over 7 years. Some women may experience early menopausal symptoms months or years before their periods stop. This stage is known as the perimenopausal period, characterized by a gradual decline in fertility from the age of 35, along with changes in the frequency and volume of menstruation. Some women may go through menopause due to medical or surgical treatment for other gynecological conditions, including women with cancer. In women under the age of 45 experiencing menopausal symptoms, a blood test is typically used to diagnose menopause. For women under 40, further investigation into secondary causes of menopausal symptoms, with or without changes in periods, such as premature ovarian insufficiency, polycystic ovaries, autoimmune diseases, etc., should be explored. For some women, the transition into menopause is gradual and may not be noticeable. However, for others, these symptoms can significantly affect their quality of life, necessitating a visit to a primary care clinician for advice and treatment. What are the symptoms of menopause? Symptoms such as brain fog, memory lapses, insomnia, hot flushes, night sweats, sleep disturbances, fatigue, and mood changes are quite common. Other symptoms may be related to sexual activities like a decrease in libido or sexual desire, and vaginal dryness leading to painful intercourse. Joint pains, headaches, and urinary problems are also often reported as late symptoms. What are the current treatments for menopause? The notable consequence of follicular depletion is a decrease in estrogen levels in a woman's body. Estrogen controls many characteristics that make women feminine, such as a supple vagina, smooth skin, stable mood, and strong bones. That is why hormone replacement therapy, HRT, is aimed at supplying small doses of estrogen for an easier transition to postmenopause without the debilitating symptoms. Women who still have their womb or uterus would need both estrogen and progesterone combined to prevent a significant increase in the risk of excessive thickening of the womb lining, a complication that can increase the risk of endometrial cancer. HRT comes in various formulations of tablets, foams, patches, and creams. For most women, systemic HRT would be a preferred method to manage the early symptoms of menopause. When vaginal and/or bladder symptoms of urogenital atrophy predominate, vaginal estrogen alone can be used. Vaginal estrogen may also be required in addition for some women taking systemic HRT. Your GP can discuss the risks related to HRT to make sure they are safe for you. For most women, the potential benefits of HRT given for a clear indication are many, and the risks are few when initiated within a few years of menopause. Common questions will explore the background risk of breast cancer, deep vein thrombosis, and cardiovascular disease, more notable in women above 60 years who are considering HRT. The transdermal patches are among the most common and safest preparations for hormone replacement therapy during menopause. They offer a convenient and consistent method of hormone delivery with a favorable safety profile. Women who still have their uterus and are not already using an intrauterine Mirena coil are often prescribed an estrogen patch along with oral micronized progesterone. The strength of the patch can be adjusted based on symptoms, but it's important to provide progesterone proportionate to the dose of estrogen for adequate endometrial protection. In a randomized controlled trial with 100 women, those who received transdermal estradiol patches were divided into groups that assessed the sequential intake of micronized progesterone. The results showed positive outcomes, with various doses and routes of progesterone administration being effective. What are the side effects of hormone replacement therapy? Some side effects to recognize in relation to progesterone and estrogen include breast tenderness, headaches, migraines, mood swings, premenstrual syndrome-like symptoms, depression, and acne vulgaris. Unscheduled vaginal bleeding is a common adverse effect of HRT within the first 3 months of treatment. Your GP will refer you to a 2-week wait-suspected gynecological cancer pathway if you experience unscheduled bleeding persisting after 6 months of starting HRT, following a change in HRT prescription, or if bleeding persists for more than 4 weeks after stopping HRT. Non-drug treatments such as cognitive behavioral therapy can be beneficial for low mood or anxiety. Testosterone can also be considered off-license in the UK for menopausal women with low sexual desire if HRT alone is not effective. Healthy lifestyle factors can improve menopause symptoms. These include a regular balanced diet, adequate sleep, regular physical activity, relaxation exercises, and a supportive community. Let's celebrate this stage of life for women by offering timely support at home, in the community, and from doctors' clinics when needed. Thanks for watching. Don't forget to like, share, and subscribe to the channel to help raise awareness of this common experience.